Great. So thank you so much for joining us this afternoon. Really good to have so many people here. Just a bit of housekeeping. If you can put yourself on mute if you're not talking, that's really useful so we don't have any background noise. Also, if you can put your camera on, I always find it really nice to be able to see real people, so I don't feel like I'm just talking to a screen. So if you're able to turn your camera on, that'd be great too. We will be able to take questions. This can be an interactive session, so we'll want to put any questions in the chat, or put your hand up as well using the react function. Then you're very welcome to come in with a live question, or we'll have some time at the end for questions too. Just firstly to say thank you so much to our partners with this. So I'm Matt King, I'm the Chief Executive of Trust Links. Work with lots of partners on this project. We've got some here today. So Dr. Carly Wood, who'll be talking in a bit, from the University of Essex, who's done the evaluation of the Growing Together Basildon project. Also, we've got Grant Taylor here from Basildon Council, so really good. Again, he'll be speaking today. Also, thanks to Mental Health All, which is a big research and evaluation project around mental health through UCL. So they've actually funded the evaluation, and we've worked in close partnership with them on quite a few projects over the last year, 18 months or so, which has been really fantastic. So thank you so much to their support as well. So I'm just going to give you a brief overview, a brief outline of the project and about this webinar too. I'll just share my screen and go to the first slide. I'm assuming you can all see that okay. Great, so thank you so much for coming. Here we are. Just so the overview of this session, we'll finish by 2. So I'm just going to give a bit of an introduction and background. Dr. Carly Wood is here from the University of Essex, giving her overview of the evaluation that's also been published, so will be available for you to see. We'll have one of our members, one of our beneficiaries, Lee Farrow, who's now one of our peer volunteers, giving his story, his experience of being a member of Growing Together Basildon, and also Grant Taylor from local authority from Basildon Council, and plenty of time also for discussions and questions. So just a little bit about Trust Links. We're a local independent charity for mental health and wellbeing in Essex. We've been going for about 25 years now. Obviously evolved and developed lots of projects and services to respond to kind of identified needs and funding opportunities over the last few years. So we've got our Growing Together project, which is what we're talking about today, which is the therapeutic gardening project. We're also commissioned by the ICB, the NHS, to run a recovery college and a wellbeing hub. So that's in South East Essex, in Southend, Castle Point and Rochford. Run a range of children, youth and families projects, right from early years through to teenage and sort of later on in life as well. So our newest one is Bouldering Together, which is actually in partnership with the local bouldering wall in Southend, so young people can come and do that. We've also got Families Growing Together, which is using our Growing Together sites and areas of deprivation to engage young people and children aged 0 to 4 and their parents and carers. We also run environmental workshops, so things that give people tools and tips and techniques to help reduce their carbon footprint and engage better with the environment. Therapeutic services is our counselling and befriending, listening support and employment support services, so quite a range of provision. Just to give you a sense of the scale, so here's our sort of overall stats as an organisation. So actively engaged last year, 4,241 people, about 62 staff, 167 volunteers. So yeah, that's kind of our scale and size as an organisation. When I started 13 years ago at Trust Links, we just had the 1 site and 6 staff. So we have grown in response to the sort of needs and the demands and the opportunities that have arisen. And just to give you a sense of the sort of the funding mix as well, because I always find that interesting to find out about different organisations. So this graph shows the sort of growth in terms of funding income and also that mix of funding from different sources, from grants, trusts, foundations, NHS funding, personal budgets, lottery funding, gifts and donations, and we're increasingly growing our fundraising offer and opportunity for people to donate to. So just focusing on the Growing Together project. So our first Growing Together project was in Westcliff, so sort of the bottom right of the screen, Southend, which is now a city, an urban area in Essex, just an hour or so east of London. Got site in Shoebury-Ness, which happened again about 10, 11 years ago. And then we've evolved to have one in Rochford, Dundersley, up in Cressing Temple in Braintree. We're actually building a site on Canvey Island later this year to be launched next year, which is very exciting. And then our Basildon site, which is the one we're focusing on today, which launched May last year. So just a brief overview of the sort of Growing Together approach. Often when I show people around the Growing Together gardens, they kind of say, oh, this is lovely, people gardening, that's really nice, you know, and kind of think it's quite a simple thing. The important thing to know is that quite a lot goes on behind the scenes. I'm sure those of you that run gardening projects know this, that there's a lot of work that happens in terms of making sure that the members' experience, the beneficiaries' experience is really positive, really supportive, and we're kind of obviously complying with things like health and safety and making sure that people are as supported and well as they can be. So there's quite a structured process that goes on in terms of assessing the risks, assessing the needs, doing baseline outcome measures to look at where people are at, which Carly will come on to talk about, for those sort of structured planned activities, so lots of different activities in a very sort of therapeutic and engaging way, and then working in co-production with our members, identifying what they want to do and where they want to go. So it could be doing cooking, yoga, creative writing, music, art, employability. There's quite a lot of different activities you can use, you know, with a green hub, that kind of green open space that people can come to. All our members get allocated a key worker. They have those regular reviews, and they also have an opportunity to engage in qualifications, so horticulture and other vocational training. So this is our Growing Together Basildon site, just a couple of pictures. So this is before we developed it. So we kind of have criteria when we set up a Growing Together site. We kind of want it to be in an urban area. You can't really see it on these pictures, but it's quite a lot of sort of dense social housing around it. Clarion is here, I think, and yeah, they manage some of the housing around the area. Yeah, we want it to be accessible by public transport. We want people to be able to get to it fairly easily. The challenge with this site is that it was on quite a steep slope. It did have a garden on the bottom right picture, had a little allotment that had been used for a few years but had fell into disuse and was really overgrown. So it's about an acre. It's quite a nice size, but yeah, a very challenging site in terms of the slope and what was there already. So our colleague Tracy did the design. She kind of looked at different elements that we like to have in the garden. We like to have a log cabin, like to have a potting shed or something similar, green roof gazebo, raised beds, so things that are accessible pathways and ways that people can get around the site in a really accessible way. Things like compost bins, and also working with what's there already. So we've got a lovely mature oak tree that's there, and other trees and other sort of features. So it's kind of working with the land, working with the community, identifying what the needs are, and then kind of designing the project responding to that. So here's the sort of after pictures. As you can see, we've got the nice log cabin here, the green roof gazebo. We've got quite a few different levels, so different levels that people can sit and chat, and the kind of it can be accessible for people to get to. Since these pictures were taken, it's blossomed even further. I think there's some little video later to see it. And then using that site to host events, activities. The picture on the right is like a glow event, one of the lights that we used, working in partnership with other organisations to kind of do a wonderful evening of lights and music and craft, and a really lovely, engaging event. Things like eating and being together as a community is really important too. Yeah, so it's just they become you kind of build it and then they come. I think people often ask like what will be, particularly like our new sites, what's going to be there, what we're going to do, how we're going to do it. To some extent, you don't know until you work with the community, with the partners, and you kind of develop in response to where they're at, what they want, and then wonderful things blossom as a result of it. Just going to promote our Let's Grow Together program. So this is for people outside of Essex, community groups, individuals, could be local authorities, could be housing associations that want to learn from what we do. So we've spent the last 25 years developing the Growing Together project, and it's been kind of then put into a manual, into a program of 6 webinars that we've got that we kind of work through with a group to help them learn from our learning. So the picture here is of a lady and her son from Texas that was actually on the Let's Grow Together project last year. So they came over and visited and had a tour around and kind of learned what we did, but also participated through the webinars remotely from Texas. So it's really good to kind of get the word out and share our learning. That's the end of my presentation. I'm going to invite Carly to share hers.
Thanks, Matt. Right, I'll just make sure I get this right because I've got 3 screens. So I've just got to make sure the right one comes up. Okay, hold on. Okay, can you see my slides? Yes, okay, good. When there's 3 screens, it always goes a little bit amiss. So hello, everyone. I'm Carly Wood from the University of Essex. I think I've seen many of you before, but we've been working with Trust Links for quite a long time now, quite a few years, evaluating and doing research into the benefits of their Growing Together program. So today I'm just going to be talking to you about the findings of our evaluation on Growing Together Basildon. So just to provide a bit of a research context to start with, we know that 1 in 6 individuals experience a common mental health problem at any time, and the most common being depression, anxiety, but there are a whole range of common mental health problems that individuals experience. And we know that individuals with a common mental illness are more likely to have reduced life satisfaction and low well-being, and to experience loneliness. In fact, loneliness exacerbates symptoms of mental ill health and mortality by 25 to 30% over 7 years. So we know all of these things, there's lots of kind of comorbidities that are experienced by people with a common mental health problem or mental illness, and this can have a really long-term effect. So therapeutic gardening, so an intervention where trained practitioners work with plants and people, and to improve not only psychological health, but physical health, communication, thinking skills, is really a potential intervention that we can use to support people with a range of mental health needs, but also physical health needs as well. And there's a lot of evidence that suggests there are a range of different beneficial outcomes for people with physical illnesses, those with poor mental health, and diagnoses of mental health. So the evidence suggests there's reductions in depression and anxiety, improvements in quality of life, community cohesion, improved well-being. So lots of different outcomes. However, one of the kind of limitations of this evidence as such is that it combines data for lots of different groups, so for individuals with and without defined health needs, which makes it really difficult to isolate the evidence for particular conditions. And we often find that health commissioners report that if they're, for example, trying to commission for depression as a pathway, that they really need specific evidence on that. And a lot of the evidence doesn't always capture people from the start of their journey, like when they first joined the interventions. And we know typically some of the biggest shifts we see are in those earlier periods. There is also a lack of data focused on the process of establishing a therapeutic garden. So obviously a lot of work goes into that to develop partnerships and work, with local communities. And of course, there are challenges along the way. So with this project, we really wanted to try and target all of that and collect information on participants as they joined a newly developed garden, but also look at how, the process of developing and opening that was. So as Matt mentioned, TrustLinks received funding from the NIHR Applied Research Collaboration Mental Health for All scheme to work with us at the University of Essex to evaluate this establishment and opening of this new therapeutic garden, which was Growing Together Basildon. So our key aims of this kind of evaluation and research process were really to explore the actual process of setting up the garden, so the successes and challenges and the whole process, so that we could really use that to inform future learning, and that can of course inform TrustLinks Let's Grow Together program and help other people who are looking to open a therapeutic garden. We wanted to look at the impact of joining a newly developed garden on well-being, life satisfaction, loneliness and nature connection of individuals with mental health problems. And we also wanted to explore the barriers and facilitators to accessing and attending, both from the perspective of members who were joining the garden, but also staff and other stakeholders. So that was really what we aimed to do with this evaluation. And I won't dwell too much on this screen now because Matt spoke a lot about Growing Together, but as Matt said, there are 6 different sites with a new one opening, and the most recently opened one was Basildon, which opened in May 2023. So obviously, Growing Together provides therapeutic gardening activities, but it is a holistic support to adults with various mental health diagnoses. And of course, there may be physical health or social concerns that come alongside those. And individuals get to Growing Together by lots of different routes. So it may be through GPs or community mental health teams, social prescribing link workers, job centres, self-referrals, finding out through your local community. So people get there by lots of different ways, and the gardens are supported by mental health staff, horticultural garden staff, and many volunteers. As Matt alluded to, there are lots of people that volunteer. So in doing this work, we had a number of different methodologies that we used to collect data on the project. So one thing that we did was surveys with members. So staff at Growing Together Basildon asked members to complete surveys upon entry to the garden. So we'll call that baseline, and also then approximately 12 weeks later. And this was kind of like on a rolling schedule. So as people joined, they were asked to complete these surveys. So we had 32 people do those at baseline, and then we have 12 people that we followed up with, just because of the nature of people coming to the sessions and when we could follow up. So those surveys looked at well-being. So we measured well-being using the short form Warwick-Edinburgh mental well-being scale, so a widely used scale to look at well-being. We measured loneliness using the de Jonge field scale, and that captures social and emotional loneliness, so kind of 2 different subscales within that. We asked members about their life satisfaction using a single item scale, so on a scale from 0 to 10, how satisfied are you with your life nowadays? And we also assessed nature connection using the Nature Connection Index. So of those 32 members, approximately 66% were male, so we had a relatively good split. And as I said, we only captured follow-up from 12, but this is an ongoing process, which is obviously continuing. So this is just almost a snapshot in time. Alongside those surveys, we also did some focus groups with garden members. So that was like a selection of garden members who had completed the surveys to really discuss the impact on their health and well-being, but kind of to understand why the intervention had an impact. Like, what was it that was improving their well-being or having an impact on their well-being? And what was their experience of joining Growing Together Basildon? Were there any kind of barriers to joining and attending, or, what really helped with that? We also conducted some semi-structured interviews with stakeholders. So this included GPs, referring organisations, TrustLinks staff. So we had 1 staff member interviewed and then 4 different stakeholders. And we really asked about what was the experience of working together to develop, fund, and open this garden and refer through. And then finally, we did also share a feedback survey with the local community to understand the impact, both beneficial and potentially any negative impacts that the open of the garden had had. We only had 4 members respond to that survey, but I think because it was so early on, lots more community members know about the garden now. So again, that will be something that can continue to be followed up on. So what did we do with all this data? So the interview focus group and community survey data were all analysed using a thematic analysis approach. So we looked at all of the interview scripts and went through and kind of gave codes to lots of different pieces of data, and then we used those codes to develop themes which reflect kind of the main things that emerge from the data. So we have key themes that we identified regarding the process of kind of developing Growing Together Basildon, setting it up, and the successes and challenges. So that really aligns with our first aim. And from all of that data, we also collected information on barriers and facilitators to attendance, which aligns with aim 3. Some of that information also came from the surveys as well. So there's a bit of a kind of mixed approach there. And then we looked at changes in mean well-being, life satisfaction, loneliness, and nature connection across the time points. Now, we primarily focused on looking at the 12 people that had match data to look at changes over time. But obviously, as we add to that database, we will have bigger numbers on that. As we looked at changes in well-being, life satisfaction, loneliness, and nature connection, we also compared the data to UK normative values. So, for example, for well-being, using the Warwick-Edinburgh scale, we have normative values for that. So the range of scores is from 7 to 35 with that. And we have like a normative UK value of around 23. So we did some comparisons to that as well. For our loneliness scales, they have different score ranges, which I'll allude to when we get to that point, and we can look at what's classed as lonely and not lonely by looking at that data. Life satisfaction, which was on a scale from 0 to 10, the average UK value is around 7.39, so we can kind of try and contextualize the results in relation to those normative values. And the same with nature connection, which is on a scale from 0 to 100, the average score is around 61. So we can try and look at our data in relation to that. So here I'll just go through some of the key findings in relation to each aim. This has all been written up in a full evaluation report, which I believe is available on TrustLink's website. So of course you can go in and have a look at in depth at all of this. I'm just picking out the key themes here. So in relation to developing Growing Together, which is the first aim, to look at, how did this process work for all of the different stakeholders? Analysis of our data revealed that there were like 3 key areas that were felt to be really important. And these were partnerships, the experience of TrustLinks, and the garden site itself. So I've just got like a little extract for each to try and demonstrate what come out of those key themes. So partnerships were really mentioned across all of the interviews that were conducted, and how important these partnerships were for getting this, new therapeutic garden open and running and referrals in place. So quite a few people mentioned how successful the partnership with the local council had been in helping to, reach out to potential new partners and, engage with the community, but also in roles for people and within the council who refer in to the garden. So that was felt to be really important. And, because this was such a key partnership, it helped to show support that had come from the local area for this new therapeutic garden, which also helped to kind of unlock other partnerships. So that's really represented in this quote that we have here. That there's lots of kind of partnerships that unlocked each other and contributed to new people getting involved and funding being identified that could support the garden. However, it was noted that obviously there's a lot of work that goes into developing these partnerships in the build up to opening a site such as this. So obviously TrustLinks have been doing this work for many years and have developed a lot of strong partnerships which have really helped to support this. So Partnerships are key, but it is a time-consuming process that, you know, a lot of work needs to go into. And it wasn't just partnerships for kind of developing and obtaining funding and, you know, getting it off the ground. Partnerships for referral are also essential for the continued, you know, entry of members into the garden, which of course is essential for, you know, continued success. And so there were lots of potential partnerships that, you know, there were lots of partnerships for referral. So people were coming from job centres, from different charities in the local area, from community mental health teams. So, you know, again, TrustLinks have done a lot of work to develop these partnerships, and it can really be a challenge to keep those going and keep developing new partnerships. So, you know, partnerships really come through as important at all stages of this process. The next thing that really come out was the experience of TrustLinks. So this was referred to in a number of different contexts. So people in relation to partnerships, you know, people were really keen to work with TrustLinks because of all of the really successful and incredible work they've done across Essex previously. So having heard about their successful work, you know, there was a real kind of keenness to work with them in the field, in the area, and develop a new garden site. But it was also, you know, TrustLinks' ways of working felt to be really important because they have a very clear model that works, and they have very kind of specific things that they would like in a site for a garden, for example, that, you know, it needs to be close to public transport as one example. So these things were felt to be really important because, you know, there's lots of evidence of TrustLinks being incredibly successful in opening these sites. So that was felt to be really key. There was also, you know, people that I spoke to within the NHS, and this quote come from an NHS representative, that the commitment and the love and the passion of the staff members really comes through as well. You know, this is something that everyone's really passionate about within TrustLinks, and that was felt to be really a key tool in the success and opening of this site. And finally, the garden site was felt to be really key to unlocking, you know, and developing this site and making sure that the right site was identified. So finding a suitable area of accessible green space is actually a very difficult thing in an urban area. And this was a real key challenge that was mentioned by a number of people, finding the right location that was accessible in terms of public transport, that people could reach, and that the planning permission could be granted for. That was, you know, really key. And inevitably there are delays with these things. So that's just something to really be aware of. There can be delays that are unforeseen, but finding the right piece of land and the right space that is accessible is really important. So those were the key points really about what do we need to think about in developing, or if you're creating a new garden, they might be really key things that you need to think about. And then now I'll just move on to some of the key findings from our surveys, which will also be kind of contextualized with some of the some quotes from members in the focus groups. So this first figure that we have here are our wellbeing scores. So at base, so these scores are just for the 12 people who took part in the repeated follow-up. But at baseline, at the start, the mean wellbeing score for all 32 participants who completed the scale was around 18.03, which was statistically lower than the UK normative value of 23.7. But for members that have completed 2 surveys, wellbeing scores improved between baseline, which is what we have here, so just around 20, to follow-up, which was approximately 12 weeks later on average. So there was a improvement across participants' mean scores, and the score at baseline, like with all participants combined, was lower than the UK norm, like statistically lower, but this was not the case at follow-up. So the score at follow-up was in line with the UK normative value. It wasn't significantly different to that. On average, there was a mean improvement of well-being of around 7.9% between baseline and follow-up. What we also found, which is really key as well is that we can classify wellbeing scores by low, average and high according to the cut points on the scale. And so as you can see at baseline, so this is for all 31 and this is for the 12 matched, we have most participants for everybody within the low category, and then quite a number in the low category here, but also in the average. And what we see towards the end is a trend towards more people being in average or also the high category. So we're seeing shifts in wellbeing categories as well, which is really important. And, you know, as we continue to collect data on that, we can see how that's maintained over time, which is one of the really key elements of the programme as well. The improvement and then the maintenance of wellbeing. In terms of life satisfaction, so remember this was our 0 to 10. How satisfied are you with your life right now, with 10 being the highest? So across all 32 participants, the average score was 4.84 at the beginning of the programme, which was statistically lower than the UK norm, which is 7.39. Now this data here is only focused on the 12 people who completed 2 scales. So you can see that this is higher than that 4 that I mentioned. And this value isn't actually statistically different to the UK norm. It is very difficult to find a statistical difference with such a small sample size, I will point out. But this is still lower than the UK norm here. And this was actually quite stable over time, this value. Remember, it is quite a short time period, but there's been a slight change, but it's relatively stable and not statistically lower than the UK normative value. Now, obviously, we don't know the reasons why perhaps the other people who hadn't followed up yet, there may be a reason that they had not followed up. They might not have been present for a while and have come back. So it would be really important to add to this data, to continue adding to that, because obviously we have a real range of scores and there's quite a bit of difference between the 32 and the 12 at baseline. But, you know, it has remained stable. And here we also have some really nice quotes from staff members and members who attended the focus groups as well as we go through. But you know, really feeding into and trying to understand why does wellbeing improve and what impact does this have on people. And there was a lot that come out about meaning and purpose and, you know, purposeful activity and feeling needed. So this is I won't read it out, but a really lovely quote on the screen here about how someone had reported to a staff member how useful they'd felt and that they hadn't felt useful in a really long time. And this, you know, had really helped to give them a sense of purpose. And I think that really is, of all the work we've done with Trust Links over the years and understanding members' experiences and why, you know, therapeutic gardening and Trust Links Growing Together has improved their health and well-being, meaning and purpose is something that consistently comes out of all of the interviews that we've done. This next slide is looking at the loneliness scores. So how did loneliness change over time? So we have emotional loneliness in the blue and social loneliness in the orange. So for members, all 32 members who completed the scale at baseline, the scores were 2 for emotional loneliness and 1.75 for social loneliness, which puts those members in the lonely category. So a score of 1 or less is deemed to be not lonely. For members with 2 completed surveys, you can see that loneliness scores did decrease over time. And there was a mean reduction for emotional loneliness of 0.58, which was actually a 30% reduction if we look at, because it's such a small score range, and then a reduction of 0.17, which is 13.4% for social loneliness. So these scores have reduced. We might expect that social loneliness, emotional loneliness has reduced by quite a large amount, but we would have expected probably that the social loneliness is the type of loneliness being more specifically targeted by interventions such as Growing Together, because emotional loneliness is about kind of more intimate relationships with partners and things like that. So, but actually it's targeted all loneliness. And what we actually see is at follow-up, and particularly for social loneliness, that we have become much closer to the border, the lonely, not lonely border. So it's just on the very edge now of participants not being deemed to be lonely. And I think one of the key things about loneliness and the project is how, a lot of people reported that yes, this is a gardening intervention where people come and, work and on horticultural activities, but actually it's about meeting other people and having shared experiences and, having that understanding. So really being with people that understand, even if they're not experiencing the same mental health condition, but they have an understanding of what you've been going through. And it really reduces the stigma and helps you to know that you're not alone. So, that really come out about how has it impact. It's helped people to talk about how they're feeling, and you can just kind of say how you feel and get it off your chest, and speak to people that really understand what you're going through. So that was it's a really nice quote that we have there from a member. The next thing was really looking at nature connection. So for all 31 members who completed a nature connection scale at baseline, the mean score was 66.65, which was not significantly different to the average score. In fact, it was slightly higher than the average score. And actually, what we see here is that there's an ever such a slight reduction in nature connection of the 12 members who completed the scale. But the thing I really want to point out is that actually that members who joined at baseline already had an above average nature connection. There could be a number of reasons for that. People might have chosen to join this intervention, this therapeutic gardening, because they already had an interest in nature, which is often something that we do see. People opt to join things that they're interested in. So that's, really great reason to join a project such as this. But also because of the nature of the questionnaires used, sometimes people think they're really connected to nature. And that's the same across all of these questionnaires. You can think you have the best well-being or you have really high nature connection. You can indicate that on the scale. But then if you feel more connected, if you've kind of met the top end of the scale, there's not much further to improve. But I think what the intervention has captured people that were already had an interest and really connected to nature. But some of the important things about nature really come out in it's really important for kind of facilitating those conversations and the kind of therapeutic aspect of the intervention, because some people, if they go into a clinic or kind of a more medical space, it becomes much harder to open up and have conversations, and people feel quite anxious in those kinds of environments. But actually, when you're outdoors, people feel a lot more relaxed and at peace. And I think that really facilitates people having conversations and feeds into, people feeling less lonely and isolated and their well-being improving. So a nice quote here from, how the environment is important for that. One other key thing that came out of the focus groups that wasn't measured in the surveys was how beneficial this Trust Links program, Growing Together program, is for supporting people with employment and helping people to develop skills and learn about insects, bees. So there was a lot of examples of people having gone on to other employment related to what they'd learned at Trust Links. And several members reported that they would like to actually go into that as a career. And there, as Matt mentioned, there is opportunity to gain qualifications. And that's really important for kind of, that holistic whole person well-being. Coming to the end now. So sorry, a lot of information. But as I said, this is all in the report. So one of the final things that we wanted to look at, aim 3, was around what is it that really, are there any barriers to people joining this intervention, or what is it that keeps people going back? So of the 15 garden members who highlighted some barriers to attendance at baseline, 6 of those alluded to socialisation as a barrier to joining Trust Links because of struggles or worries over socialising and meeting new people, social phobias. And there were also mentions of physical and mental ill health by 10 out of the 15 members. So people might have a physical illness, pain or mobility issues that really prevent them from engaging fully in the gardening activities, or potentially relapses in mental health or worsening of mental health during attendance might make it really difficult for people to attend. And as you can see from the quote, the flexibility of the service in relation to these was deemed really important for keeping people going, because people and members knew that, they could go to the garden and engage as much or as little as they wanted on any given day. So you can go and have a cup of tea and talk to people. You don't always have to go engage in gardening activities. For example, if you have a physical condition and you're in a lot of pain that day, or if your mental health just means that you don't want to do much or find it harder to go on a particular day, it's very flexible and people can come and go as needed. So that was really something that supported people joining and continuing to go, because they knew that they could use it in line with their own health needs. And that's one of the really great things about Growing Together and gardening interventions, so, that it is flexible around the individual and their own health. So from this, we've pulled some key learnings and key recommendations, and some of those are for the site, which is still relatively new. So continue to develop referral pathways to continue to get people to go. So since we've done this initial evaluation, the site is open for another day and more referrals are coming in from different routes. So that is actually already in place. So again, that feeds into a couple of those points there. Increased use of websites and social media and sharing of good practice to engage the community. So again, we captured this so early on, but I know from being at the site recently, there's lots more engagement from the local community already now, and people are attending more. And what we really want to do is carry on with those surveys to get greater numbers to really track this further over time, because we just captured that very first period of opening. And finally, what did we learn more generally that could be applied? So some of the things we learned, that anyone looking to open or develop new therapeutic gardens in the future should really consider relationships and developing those early and from the outset, because they are really key to the success. Partnering with other providers. So for example, Trust Links, if someone is new to doing this, it's a really good idea to partner with a more a provider that's really established, because that was really key to the success. So again, Trust Links are a really good example of that. Make sure the garden location is accessible for members, and all the kind of permissions are in process, and think about all the barriers for individuals potentially attending and how they might be able to be overcome from the outset. So that just brings me to the end of my talk, and really the conclusions are, we see just from this very small number of people that there are improvements in wellbeing and loneliness, and opportunities for employment and skill development, which really help with maintenance and improvement, but maintenance as well of physical and mental ill health in a supportive environment where there's activities that can be tailored to the person. So we know that projects such as Growing Together really have the potential to reduce public health costs associated with loneliness, life satisfaction, and mental ill health, and can improve people's lives and give people another option, another treatment option. So that is the end of my talk. Thank you for listening. Matt, do you want me to do questions and then the video, or go straight into the video?
I can go straight to the video. That'd be great.
Okay. Yeah. So right, let me just get the video off on my screen, and then I'll reshare. I've got so many things open. So this is a video that we recently developed at Growing Together Basildon. So this is just a short clip. The full video is not out yet. Just a video that we put together to showcase some of the wonderful work that's being done. So I made this mistake before. Let me make sure I share my sound. Okay. So can you see that, Matt?
No, not yet.
Oh, no. Okay, it's going to share. Right. Can you see this now?
Yes.
All right. Hopefully, I'll just play it and just pause it to check you can hear it. Is that okay? Okay, here we go. We are at Trust Links in Basildon, which is a therapeutic gardening site, one of several different sites throughout Essex, where Trust Links have lots of individuals come along to take part in therapeutic gardening. So our research looks at the health and wellbeing benefits of engaging in therapeutic gardening activities. From this research, what we really want to do is try to engage health professionals and to try and make these types of interventions more widely available to people. So as one of the outputs of our review, we are developing some infographics to try and present the evidence of the benefits to a range of different groups. So we have some for potential members, we have some for health professionals such as GPs, and we also have some that are more aimed at commissioners and policymakers. So that is really the hope, that we try and get these interventions more widely available, more widely funded, and people to know about them, because I think sometimes people don't realise that these interventions are available right around the corner from where they live.
For some people, it's the only place that they come. So just being outside, but in a safe space, is really, really important. And they say if I wasn't coming here, I would just be sitting in my flat on my own. I have seen that people that didn't leave their houses maybe for 4 years or more really flourish, being given a purpose, and then later on communicating what they've learnt to other people and guiding them within the garden.
If I hadn't have found Trust Links and come here, I don't know what I'd have been doing now, to be honest. I was in a really bad place. It sort of opened up my eyes to there's more, there's loads of things you can do, there's loads of opportunities, and Trust Links really encourage that. They sort of go, right, if you're interested in this, we sort of get behind you, help you out. Like my peer support course, they got me signed up for that. They've moved me on to being a member, to a volunteer. So yeah, I think the opportunities to make people sort of feel more direction, more purpose it's massive, really, yeah.
Okay, there we go. So we will have a full 5-minute version which we can share. Lee, I hope that was okay. First time seeing it. I don't know if there are any questions.
Thank you, Carly. Shall we go straight on to Lee, and then come back to questions at the end?
Yeah, perfect.
All right, there you go, Lee. Over to you. Thank you so much.
Afternoon, everyone. So I'm Lee Farrow. I was a member at the Basildon Therapeutic Garden. I'm now a volunteer. I think pretty much between Matt and Carly, they've pretty much covered a lot of the points we're going to talk about. So I guess this is going to be more of my sort of story, sort of how I come involved with Trust Links, my process with the garden, and sort of what direction I'm heading in now. So up until I'd say about 2020, I was really involved with the music industry and the nightlife economy. It sort of all come about when I was really young, and when I was about 13 or 14, I set up a pirate radio station with some of my friends, just to play music to our mates, really. But that gradually progressed and got a lot bigger than what it should have, and sort of led to organising nightclubs, promoting events, graphic design. Yeah, so it sort of really is something I just done as a bit of fun, really, and it sort of went off the scale. So in the early stages of that journey of all the music stuff, I think I was pretty wet behind the ears, really. I didn't realise sort of what sort of was involved, what sort of people you're going to sort of come across. And then you sort of end up becoming products of your environment, I guess, to sort of just keeping that sort of industry. And I think also back then, I was sort of really driven. That was literally the only thing I lived for. And I'm quite stubborn as well. So that made it really difficult for me to sort of back down from sort of certain situations which arose, which were quite volatile sometimes. And I think that just sort of being in that lifestyle, I sort of, that was literally 24/7. So I just got burnt out. But at the time, because that was all I knew, it was sort of, I didn't notice the sort of negative effect that was really having on my mental health at the time. Didn't even realise it was a problem, so I just sort of carried on with it. And it wasn't until probably COVID and the lockdown sanctions that when they were introduced, I sort of went from this sudden switch to sort of being fully doing stuff 24, literally every hour, every minute I was awake, it was just music. And then I had so much time on my hands, and I guess it was just a massive shock for my sort of normal day-to-day life, and I just felt completely lost. Sort of felt like I was stripped of my identity, I guess, and what was I going to do next? Although I think that gave me a bit of time to sort of sit back and think, actually what I've been doing probably isn't the best sort of best choice really. So I knew I needed to change something, but I didn't know what was going to really sort of give me that, what was going to replace that sort of zest for life and sort of the buzz I got from doing that really. So as I had no work to do, I was sort of just stuck in a rut. So my mental health really started declining after that. And I was sort of thinking, right, what can I do to fix myself? Because I guess I was sort of at the stage where I didn't really want to sort of admit I had a problem. It was a bit of a stigma involved around mental health. So I just tried fixing myself really, like looking up stuff online, reading books, just trying to find any way what I could sort of sort myself out without sort of having to approach anyone really. But in December 2022, I hit a really low ebb. None of that stuff was working for me. So I then found myself in Southend Hospital's A&E to see their mental health team. Then I was prescribed medication, so on talking therapies. So this sort of was the beginning stage of 2023. So at some point during those couple of years, when I sort of had nothing to do from sort of 2020 to 22, that was when I sort of thought, right, I need to get away from the music stuff. So I sold my record collection to a shop here in Southend. And it was there when I was sort of looking through the flyers and leaflets that were on the table there that I noticed a leaflet for Trust Links. Bit of a strange place for a leaflet like to crop up because it's usually just sort of events and records and whatever. But I found out that the guy who actually owned the shop, his partner, actually worked for Trust Links at the time. So I picked up a leaflet anyway. I don't know if that was some sort of secret message to me about, oh, you should go and check this place out. I really don't know, but it was a couple of months after this that I was engaging with Laura from employability, and we were sort of discussing what routes I could sort of take, sort of work-wise, and also for my own well-being. And I mean, I've always sort of had a thing with nature and environment. It's always sort of chilled me out. I like going for walks in the middle of nowhere, just sort of decompressing, getting away from everything, and just find it really grounding, really. And that's when I sort of remember the Trust Links leaflet. So I was talking about Trust Links with Laura, and she happened to have a contact within Trust Links, and they were doing an opening day about 2 weeks after that at their new garden. So I think within like literally 2 or 3 weeks of sort of going, oh yeah, this Trust Links route looks like a good sort of option to take, I was literally signed up as a member at the Basildon garden. I think the thing what makes it really different is that when I've been to sort of traditional counselling, like talking therapies in sort of a clinical setting, it's just the whole being outdoors thing. It just felt completely different. Just felt easier to talk to people. It just felt completely different to sort of just being sort of sat in a room with someone for an hour or a week, just sort of talking about stuff, to sort of being outside, being around other people who have obviously had their own struggles with mental health as well. And I think really that's one of the massive things that I noticed straight away with Trust Links is that we're all there together. We can all support each other. We've got like a mutual understanding between the members. So you don't sort of feel like there's any stigma because you know that everyone's sort of been through the same sort of struggles themselves. And just sharing those experiences, really, I think creates a lot of optimism. You think, actually, I'm not alone in this. There's other people out there. We're all going through the same thing. We can help each other. And I definitely wouldn't have discussed that with people in my immediate sort of social circles, as I said, because of the stigma attached to it, really. So I think really through that as well, I then sort of uncovered this whole thing about actually just talking to people is like a massive, massive thing in sort of getting you out of this rut, really. So Trust Links signed me up to a peer support course with IMROC. So I've done 15 modules on peer support work. So I completed that last year, and I'm taking that through into my volunteering now to hopefully be able to project what I've sort of learned through the project to sort of pass that on to other people who are coming through the process, and hopefully make them feel better. And then they get to a stage, it's like a continuous cycle. So they sort of get to the stage where they think, actually, I can do this as well now, and we can all help each other. And also another massive thing which is really sort of prominent for me within Trust Links is the co-production side of the charity. So they've got Reach, which is their Wellbeing and recovery branch of the charity. And it really just lets members sort of have their say, get their voice heard, so they can sort of shape sort of where the projects are going in their own way, really, without just sort of thinking, oh, I'm just turning up, being told to do this. It's like you've got your actual input into it, and you actually feel like sort of you're part of the whole project, really. And that's where a lot of things started falling into place for me. So I could start using sort of my previous skills in graphic design and the stuff I'd learned myself previously through like learning about well-being and all the sort of tools and techniques. And I joined up with the Reach Recovery College to sort of design a well-being booklet, which they're now using. And I'll say the third thing, which I've really noticed and which is really sort of a massive impact on sort of where I'm heading with things, is just the importance of community. So although before I had my own sort of community in the music, it was very closed off. You're in your own little bubble and sort of everything else didn't matter. You didn't really take notice of stuff. But because obviously TrustLinks is obviously involved with a lot of different sort of organisations, I've sort of met different people through that and sort of realised how much impact it can have just sort of integrating into the community. And they also offered a workshop from Social Spark, which was part of Anglia Ruskin University, to do a course in community organising. And I found that really sort of really tied in with what I was doing before with my obviously I was doing event organising, promoting. It really sort of just tied in with that, really. So when the funding's gone away from Basildon, I think it's gone to Harlow now. The lady heading up the course was like, oh, someone sort of want to take the baton on this and sort of carry on with what we're doing with these events. So I was like, yeah, it really sort of resonates with me. So I've sort of taken that on board now. And I've actually got an event on Friday, as Matt said earlier, the Van site's also used for other events. So I'm using that, luckily, to host another networking event. And I guess none of this would have come about, really, if I'd have just thought, oh, I'm just going to try and sort myself out, not going to let anyone else help me. I guess I'd have never gone to the garden, and all these things wouldn't have happened. So it's all sort of fell into place, really. Just the encouragement as well. I mean, before I was really closed off. I mean, I wouldn't let no one else know about sort of my problems. Guess I had a really linear mindset. Didn't really want to be open to people because I felt that sort of being weak. And also, like, from being in the music stuff, sort of if someone done something for you, you always knew that you'd have to do something back. It always felt like there was always like a sort of transaction sort of involved. So as Carly said as well, just rediscovering direction and purpose, really. It's really sort of gave me that zest what I'd lost for so long. But also having all the people around you in TrustLinks, especially the staff, obviously the volunteers and the members, it's just sort of that support network, I guess, which is sort of changed my narrative on that. So I think TrustLinks really sort of sums up the whole trust thing, which I didn't have, which I've now got, and also linking me up with other organisations, sort of spreading out and sort of just moving forward, really. So going forward, really, apart from these networking events, I just really want to try and advocate social prescribing, because when I really suffered with mental health, and obviously I ended up at the hospital and got medication, there wasn't really any mention of, oh, do you want to try and like go and do this gardening thing first before you start taking like medication? So I think really that should be, although the medications obviously helps, I think really there should be a much more emphasis on social prescribing. And also I think breaking down the stigma around mental health. I mean, sort of 5-6 years ago, I'd have been like, oh no, I'm not telling no one. But it's just so important to just open yourself up, go to these places and just let people help you, really. And also, I think just in general, if we can just sort of spread the word about wellbeing, sort of do courses before people actually reach like a really bad point in their lives, just because obviously everyone's susceptible to mental health. So I think really just sort of getting in the community, sort of just teaching people general wellbeing stuff so they can sort of maintain their mental health is really important as well. And just to finish off, really, I think the main thing which I'm really passionate about within TrustLinks is obviously looking at my journey and then seeing people who are just starting out in the service, thinking they can do exactly the same as it's your sort of like living proof that it can be done. And just seeing them sort of flourish, sort of see them sort of finding new sort of avenues, what they're good at, what they want to be doing. And obviously those then sort of just passing that on to the people. So it's like a continuous chain, really, of everyone helping each other. Yeah, and hopefully just by doing that, we'll create better futures for everyone. Thanks for listening.
Oh, thank you so much, Lee. That was really brilliant, really eloquent and clear, and there's a lot of love for you in the chat as well, which is brilliant. So yeah, thank you so much for sharing your story. It's really powerful. I'm going to hand over to Grant Taylor now, who is from Basildon Council, to share his perspective. Then we'll come to questions at the end. So yeah, that'd be great. Thank you so much for joining us today, Grant.
No problem. Thank you. Thank you for the invitation. Yeah, look, let me start by saying it's an upward struggle sometimes working in local authorities. Lots of change, lots of difference, lots of challenges, certainly from a financial point of view at the minute. But listening to Lee there, Lee, thank you for sharing what you shared, because coming along today, it's really helpful. It reflects back on why we do what we do, to be able to support organisations like TrustLinks to operate and see the change that it makes. So massive credit to you and your journey and the work you've done. And I know we met last week, but that was really great to hear your story, and I'm really interested in seeing where it goes next. Starting this Friday in Basildon, I'll plug that again, TrustLinks Vantage site. So my name's Grant Taylor. I am the Assistant Director for Community and Leisure at the Borough Council. My responsibilities include, like often happens in local authority level, I've got quite a wide remit, but I think it all makes sense, and it's all the stuff I'm most passionate about. But I've got the responsibility, I guess, for that kind of community, leisure, culture, health partnerships, inclusion, diversity, environmental health side of the organisation. And I'm lucky enough to say that I entered working for Basildon, my first local authority, almost 21 years ago, as a community warden, kind of walking the streets, kind of pointing out where there was graffiti or broken curbstones, and kind of creating all my colleagues lots of work that they couldn't possibly keep up with. But it's been an incredible journey since that period, and principally my development and my training and my work has been as a community development officer. And I like to think that as an assistant director, that's kind of still what I am. I'm a community development officer, but with greater responsibilities. But principally at the back of that is how through my role, or how through our organisation, can we enable great things to happen in our borough via our communities, via our partners. And I say that because I'm very proud of working in a local authority. I'm very proud of working for Basildon Borough Council in particular. But we are in no position to do this alone. And that's why having strategic partnerships and being at the point of always of starting with wanting to say yes, and how can we support and how can we make something happen, is important. Now that's different to me saying we always say yes, because of course we don't. And Matt and myself have got probably some stories around how we have to jump through some of those hoops at times. But starting with how are we going to reach the outcome is really where I like to start our practice, really. Clearly, we recognise the importance of health and wellbeing of our residents. We're not a health authority, we're a tier 2 authority, working with many partners, not only with NHS, but also with our county colleagues who are our public health colleagues. But we also need to recognise that, as strong as our relationship is with the county council, they don't necessarily see the whites of the eyes of local people in a way that the borough council does. So it's absolutely incumbent on us to be able to work collaboratively at place and to advocate on behalf of our space around health and wellbeing. So we have responsibilities in that area. I spoke about mine earlier. We've got health and wellbeing policy and strategy and the like, and but most places will, and that talks about those priorities that they're quite. They're quite varied, but also not necessarily non-specific. So we will talk in relation to how do we work to be able to reduce obesogenic environments. How do we support residents with improving their mental health? And the biggest catch-all, I guess, is how does the wider determinants of health are not impacted too much by their lifestyle and the way people live. Clearly, the work that Trustlinks does is absolutely imperative to that. Our strength, I think, before working with Trustlinks was we had a strong ecosystem in working with system partners in the voluntary sector. But if I'm honest with you, principally around often sport, physical activity, and other kind of community and health programs. That ecosystem is really important to us with regards to how we are there to support residents. We run a lot of services ourselves that do so, but the reach and the trust that the voluntary sector can have, it makes it absolutely imperative that we do what we need to do to be able to strengthen that sector where possible. Now, the Trustlinks work started in Basildon really because residents had raised up really and worked with a local housing association prior to Trustlinks working with us on the benefits of therapeutic gardening. And a piece of work had been done which had started up with a community garden over in Vange with the local housing association. But in fairness to the housing association, theirs was they'd helped commission a local an Essex CIC to help them run with that. Now, part of the difficulties with that was I think that the level of expertise in the kind of the horticultural piece wasn't necessarily there in the way that I think it necessarily was with regards to just kind of their health angle. And cutting a long story short, that project galvanized the community for a period of time, and then for whatever reason it just fizzled out, and we had a derelict site. It was land that, again, as I mentioned earlier, the council were given free access to, but we were left with a situation where within our borough, a project that the council hadn't really been involved in, but we knew that there'd been a drive from the community, there'd been some work done, it had fizzled out, and therefore there was a cohort of our community that perhaps wasn't getting the support that they needed around the project that they felt most passionate about. So it wasn't about saying, well, don't worry about that because you can go and join this football club, or you can go and join this cultural organisation, because actually it was therapeutic gardening that mattered so much to people. And I think that's where really our conversation with Matt started. Not really to say to him, go and sort it out, but actually there's the origins of a conversation here in Basildon where my nervousness is this community want to drive something, but haven't really found an anchor for them to be able to do so. I believe that there's incredible capacity within this community to be able to do so, but we need that expertise at place. And obviously, Trustlinks have been doing this, for a generation now, and that's when our work started to see how we might do so. Finding a location to do it, and I'll go back to what Carly was saying earlier about finding the right location in the right place. It's really difficult for us as local authorities. Often, there's for obvious reasons, there's not often pieces of land laying idle in South Essex, where we've got our own housing crisis as much as anyone else. If that kind of brownfield land is standing idle, it's often not in the central communities or where communities are placed. If it's not where communities are placed, it's often where there's not good public transport measures. So finding that space in Vange was difficult, and I think it's fair to say, you saw from Matt's pictures at the beginning, that it wasn't probably the most. It was a great candidate in relation to location, but probably not on a topographical point of view. When I showed him at the kind of the side of a hill and said, "What about this?" And we made it work. So massive credit to the team for doing so. But I really do admire that about Trustlinks is it's not in relation to where we might be able to find for them, and they'll just change their model to make it work for the outskirts of a borough, which would have been simpler to do so. They're absolutely insistent on what they need to do to make it work, and I think that's really important to hear as a local government officer, when I think sometimes the conversations like anything you can give us will make it work. And I think that demanding back on us and reminding us, actually, if you want to make this a success in this area, this is our hard line to do so. I think was really, really important. So that specialism that TrustLinks brought around horticultural gardening, horticultural, I should say, mental health support, I think it was absolutely imperative for us. And when I talked about that ecosystem earlier around what we had and what we didn't have, it was one of the gaps. And I think what's important now is I'm coming here to talk today about TrustLinks as a system partner rather than an organisation that is operational in the borough. And I say that because it wasn't at the point we got the planning permission and, you know, the difficulties that comes with such things like that, and, you know, working with local residents in relation to their concerns around anything new happening in the areas where they live. We didn't stop at that point. So TrustLinks is now very much kind of part of the fabric of Basildon, and they're very much part of our conversations in relation to how that continual pursuit of supporting residents and more importantly, working alongside residents, I should say, to improve equity, opportunity, health, well-being, and just participation at place. They are absolutely central to that. And I was only at site last week with the director for our Health Alliance, coming back in, checking in, understanding what more we might be able to do together, understanding what the challenges and asks of us are as I guess those people that somehow find themselves as system leaders in this space, and how do we get TrustLinks and their others closer. I'm always very, very pleased to hear also about how TrustLinks and their brethren are working collaboratively. And I think that's, again, one of the things that we need to get right as a local, as a sector, not as a local authority, but as a sector. Often the relationships between voluntary sector organisations can be a little bit, they can be difficult when everyone's asking for the same money and pushing for the same money. So our role really is about how we pull people together around that collaborative piece. And I think that's one of the things that we've worked really hard to do in Basildon through our community's work. Now, taking that back, one of the ways in which we've been able to kind of make it happen here is Basildon is one of the Sport England's local delivery pilot areas. And basically what the local delivery pilots are how Sport England, they're not about bats, balls and swimming pools. And as important as those are, then they will inevitably, investing in bats, balls and swimming pools, you're very likely to kind of get people that like doing sport and wear a tracksuit and have a whistle and have good trainers and more power to those people. But it can't be for everyone. So the LDPs were about actually taking a community development focus on how we tackle the inequality of people not participating, not being active, and that is active physically, and we all know the benefits for movement. And I'm not talking about sport here necessarily, but movement, and also being a participant in your community and the value that it brings with, you know, feeling like you like where you live. The health impacts of that are absolutely seismic, of course. We started a conversation very early with Sport England when we were trying to pull together the funding for this, and said about gardening. Anyone that's got a garden will know that it is a physical pursuit, or I'm doing it wrong, if not. But that was quite a difficult conversation with our Sport England partners, where there's not necessarily rules and regulations around it. But we were absolutely passionate that this would reach the communities, or would help us reach those communities that were not being reached through their traditional approach, would help people who were never going to be kicking a ball around to be more active. Certainly those that don't have access to a garden or not much of one. And that's, again, one of the major reasons why the planning around being in Vange rather than you know, perhaps north of the 127 in places like Billericay, etc., was so important to us. I think one of the big pieces of work, therefore, was around how we galvanise together as funder and local authority, and the advocation with our public health colleagues at County Council, with the active partnership, Active Essex, to be able to produce and co-produce with Sport England a position paper on investment in therapeutic gardening, or gardening for physical activity, more to the point from Sport England's point of view. And TrustLinks, therefore, this was not only the first time Sport England had invested in physical activity through horticulture, but it was a significant investment too. And I think when I focus on kind of what our role is as the local authority's view, I think that's one of the things I would say. As a tier 2 local authority, we don't have a lot of money to give. So therefore, it's about how we collaborate, how we sweat our assets, how we sweat our advocacy and influence to be able to make things happen. And I think that is principally the story of TrustLinks in Basildon, working with us as the local authority. How have we influenced funders to change their minds around what they fund? How do we build that case? How do we give strength to that argument as place leaders? And knowing that we can only do that through collaboration. Now, I appreciate today we're talking about Growing Together in particular, but I think it is also worth raising that from this, other projects have started to happen, and that kind of asset-based community development way of working started to then kind of influence kind of how we also started to see how TrustLinks could be our system partners in relation to other different methods. Sorry, no one's brought up COVID until now, so I apologise. I was the first person to do so. I'm sure there will be a time when we'll go to webinars and they won't. But TrustLinks were really, really key partners for us in that stage with regards to, I was running the community hub response at that time about how we kind of got food, medication, hearing aid batteries, books to kids, anything else we need to do during that period. And TrustLinks helped us out with regards to kind of gardening kits and seeds and planters, and so people could actually, when they could only go into their garden and not do much, how we enable them to do so. So that's beyond Growing Together. Latterly, we started something called Greening Basildon together, whereby we were working with communities in priority estates, forgotten estates, some would say. And Basildon is, as a new town, has a lot of housing estates in those places, but how they could work to give the permission that wasn't needed, but often communities felt was needed, to be able to seek how they could green spaces and places that mattered most to them. And that was a really interesting project. And I say interesting because actually it came with its own challenges, because and there's much still for us to learn. So when I'm going to come here talking about a local authority response to this, there are parts that still remain frustrations that we still have to work through. And who owns a piece of scrubland, whether it's Essex County Council or us or someone independent? And the honest answer, we couldn't even find out at times, which is again is one of the anomalies of working in a new town where we've only been here since the 70s. So getting permissions in spaces and places where communities could take them over and TrustLinks could work with them was much more difficult than it needed to be. But I think what it does show is that there is an endeavour to continue to go, well, how do we grow out of Growing Together? And one of the big key things that me and Matt are speaking about very much now is there's a nature reserve behind where this site in Vange is, and we've got nature reserves all over our borough. And it probably won't surprise to hear people, probably won't surprise people to hear that, picking on Billericay and the good people of Billericay, there is an incredible movement there in relation to friends groups taking over and managing and helping us manage and maintain those nature reserves for the benefit of nature, for the benefit of communities. But that's not naturally there over in Vange and places like Vange. And I think that social divide you will see up and down the country. So one of the things we're really keen on now is how TrustLinks work with that local community to be able to kind of equalise that piece, to ensure people have that, they take up their given right to access to beauty. And I think that the trust word in TrustLinks is particularly pertinent for our communities. I'd like to think they could trust the council, but we have to all accept that, that there is, in statutory services, sometimes there is that lack of trust. And therefore, if we're outcome focused, relationships with organisations like TrustLinks are absolutely important for how a council is able to meet its strategic aims, which ultimately are about improving the lives for residents in our boroughs. And I think that's probably all I want to go through, because I think I probably taken up too much time. But thank you for the opportunity, Matt.
Well, thank you so much, Grant. Such a really great insight into your perspective and experiences, and obviously, yeah, been such an important part of our journey of developing our projects in Basildon. And yeah, I mean, Grant's just been a complete stalwart with all of that. So I'm going to draw the main session to a close. Thank you so much for everybody that's contributed, to Lee for telling your story so powerfully, to Grant, and also to Carly for your amazing research and work. Yeah, and thank you everybody for joining. I'm going to stop the recording now, and then we've got about 3 minutes for questions. So thank you so much.